All right, we'll get started. I'll make sure that we're on camera. Cool. You don't mind if we're recording. We're all on social media now, so we're trying to liven it up a bit and spice it up, I guess. But wanted to thank both of you guys for spending some time with us tonight. So the whole point of tonight's presentation, give you guys a little bit better understanding of what we do as chiropractors, some health tips, tricks that you can add into your day-to-day life that with consistency can just help you in your life going forward. But a little bit of my backstory, because I don't think you guys know kind of why I got here. So my mom was a patient here kind of before I was born. Dr. Brian's dad started this practice in 1983. My mom showed up on the doorstep in 1993, and she had lower back pain, but she couldn't get pregnant. And we'll kind of uncover why tonight that is. But she couldn't get pregnant, and she came in, got adjusted, was able to get pregnant, and then she had me 9 months later. And then I developed colic as a baby, which I know if you guys are moms or soon to be mom, you know what that is. So, you don't know what that is? Oh, okay.
No, I hear it's not good.
It's not good. If your kid has colic, bring them in.
Yes, that's why I started here. I brought my son.
Oh, you?
Yeah, because
Okay.
he had, well, I don't know if it was officially diagnosed, but
Yeah.
he was bordering on.
Bordering on colicky, yeah. A lot of kids have it. It's, in short, just a gastrointestinal problem, but it causes them to fuss, not taking in food as much, all that stuff. So I had that, but chiropractic helped me and obviously helped Dana's kid. But then later in life, I got diagnosed with Crohn's disease. So do you guys know what that is? Okay, yeah. So I had that. I got diagnosed when I was 15. But the long and short end of it was I had to go to the hospital. I lost like 50 pounds, got a bunch of blood transfusions, was told really I would lose my colon. It was really debilitating. And the overarching theme of that entire point of my life was I didn't really like the medical community as far as like, it's take this, it'll make you feel better. Felt very transactional. It didn't feel like I was cared for, really appreciated, or not really confident in that they were going to help me get better long term. But Bill Wallace, who's Brian's dad, he came to the hospital and sat with me. And that interaction that he had with me made me want to do this. Because it wasn't like he cured me or really got me better. It was the fact that I was cared for in a way that really nobody else could give me at that point in my life. And I was like, I want to do that. So that's why I stand before you today. In a more, obviously going through school and being a chiropractor for 4 years now, just having a more background in like, let's do other things besides drugs or surgery before we go into that. Or it could be like working out or acupuncture, massage. There's other things that you can do that I think add a great impact into people's health and longevity long term. So that's kind of why I'm here. So if you guys have any questions about Crohn's disease, let me know because I'm an open book. But again, thank you guys for coming. Let me go into our little presentation. So a couple things that I also like to talk about, because when I grew up and when I had Crohn's disease, I was told, because I had to go on medication, my immune system was compromised because of the biologic that I was on. So if you guys have a charged up immune system, do you think you would be healthier? And by charged up, I mean like increased immune system, boosted.
Yeah.
Why? What's the job of the immune system?
Fight off disease, illness.
Bingo. So the immune system, like you said, is protecting you against bacteria, viruses, pathogens that you come into contact with. And if I told you the nervous system and the immune system were connected, would you believe me? I'm glad you're shaking your head.
Yes.
I hope you are too. So this study shows us the connection between that. And the nervous system is what chiropractic is actually looking at. What this study showed is people went into a chiropractic office over a 6-month period, and they looked at their immune system levels before and after an adjustment, and they found an increase of about 50% in their immune response. So we're not having an influence really on the immune system. We're having an influence on the nervous system, but there's a connection there, right? I find that very interesting. So when I was told that I was immunocompromised, when I was getting regularly adjusted, I noticed I really wasn't as sick as much where I could get over stuff faster. But then I went away to college, and you know what happens in college. But I really wasn't seeing a chiropractor as often as I was up there because I liked coming here, so on and so forth. But I was sick more often. I would develop other things. So that's kind of why I find that very interesting, right? And then I'm going to go back here. A couple chiropractic facts I always like to talk about. 80% of the population is going to develop lower back pain at some point, but we're only seeing about 10% of the population. There's a big discrepancy. That's why we always like to encourage our patients to come to a talk like this, because it gives you a better understanding of what's going on. And then 60% of the patients that receive chiropractic care, they're going to notice a change in some other point of their health that might not be the problem that they came in here for. I mean, we have a lot of people that come in, classic lower back pain, neck pain, some type of musculoskeletal pain. But a lot of our patients, they have gastrointestinal problems that could be linked to that, and they see a benefit in their gastrointestinal problem even though they didn't come in here for it. So I find that really interesting. All right. So chiropractic, it's all about the nervous system. So what do we guys know about the nervous system?
Not that much.
All right. So the nervous system, in short, is your electrical highway of your body. It coordinates and controls everything you do, everything you think, everything that goes on in your day-to-day life. So it's made up of really three parts. It's your brain, which is in your skull, your spinal cord, which is kind of what we're dealing with on a day-to-day basis and adjusting you. And then there's your spinal nerves. Hi, Jen. Have a great night. So that system also is the first system to form after conception, which is something to take note as well, because that is your electrical grid of it controls everything in your body. So it's a very important system. But basically, your brain is what tells your body what to do, coordinates and controls everything. But it needs a highway to send that down, and that's your spinal cord. So I'm taking my handy dandy spine out. So I did not take this off a dead body, but this is fake. I pinky promise. But this is your spine. Your head would be up in here, and then this is your pelvis down in here. These yellow things coming out of the spine, those are your spinal nerves that are attached to the spinal cord, which is located in here. So these nerves, they go out into your body, and bye, Kelly, and they go everywhere. Some of these nerves, they go to your eyes, some go to your skin, some go to your organs, some go down your legs, some go down your arm, but they go everywhere in your body. So the way I like to think about that is wherever those nerves go, if there's an issue with that nerve, it can affect wherever the nerve goes. Does that kind of make sense? Okay. So this is, I know it's a little small, but this is a diagram of where all those nerves go in your body, which is really, really cool. So you have 33 sets of spinal nerves that go everywhere. Okay. So now let me go here. So when we talk chiropractic, we're looking at a subluxation complex, which is a big fancy way of saying you have a nerve that's pinched. So when that occurs, we'll say like this vertebrae is out of alignment and it's pinching this nerve. This nerve, it's around T6, it's going to go to stomach, could innervate upper GI, things like that. So if this bone's out of alignment, it's going to pinch that nerve. So what's really going to get that bone back into alignment? Would it be maybe an injection, Advil, or a chiropractic adjustment? What do you guys think? Adjustment. Yes. So, and I'm not saying that this is the panacea that's going to fix everything, right? But if that bone's out of alignment and that's pinching that nerve, and we take that pressure off that nerve, and nerve goes to your stomach and you're having a stomach issue, that begs the question as to, wow, what's going on there? Then that's going to be better, right? So that, in essence, is what chiropractic is, and that's what we're looking at. And there's a couple things that we also talk about as far as innate intelligence, which a lot of you might hear that like us talk about that in our office. But innate intelligence basically means your body is a self-healing, self-regulating organism. It's made to figure out whatever life throws at it. It's made to figure out what's going on in life. So when you get sick, your body brings up a fever because it's trying to raise your body temperature to kill the bacteria, because that bacteria can't live at a very, in that temperature zone. Hello, Susan.
Hello. What he said.
Have a great night. All right.
Right. You too.
And also with innate intelligence, there's two components as well. There's self-healing and self-regulating. So self-healing, like you can see up there, is like a cut, right? So I cut my finger and I put a Band-Aid over it. What's healing that? The Band-Aid? Body. But it's kind of like things we don't really think about, right? But your body's healing the cut. And same thing with self-regulating. Today it's probably minus 30 again outside today, especially now when it's dark out. But if I stuck you outside without a jacket on, or like in shorts and a t-shirt, what would your body do? Shiver. Yeah, because it's trying to warm up your body. And if the opposite, if I stuck you outside in July with the coats we have on today, probably gonna start to sweat. And that's your body trying to cool yourself off. So that's what those two things are all about. But in essence, your body's trying to figure out. Welcome back, Susan.
Ryan?
Your body's trying to always be in homeostasis, always trying to be there. Does that make sense? Perfect. All right. And then this is a really cool picture. So this is where all your nerves go in your body. That's actually kind of like a model too, which is really cool. All right. So that actually was the first chiropractic adjustment right there. Okay, so my part is over. Wanted to give you guys kind of like the background of chiropractic. What do you say? He's not ready? Oh, okay. He's coming. It'll just be a few minutes.
You just got done.
Just duck and walk
We're
out.
ducking.
They're
ducking.
the best. That's all they need to know. Bye.
Bye, guys. But I wanted to give you guys kind of like the background of chiropractic, what exactly we're looking at, kind of my story too. But do you guys have any questions about that?
No. That
Good.
was interesting. Yeah, I didn't know that. Like why we do it.
Yeah. Yeah.
Or what you think.
Yeah, totally. So, but I know we'll wait for Dr. Brian because he's going to kind of finish up the latter half. But I'll touch base kind of on this though too, because healthcare versus sickness care, in like society today, I think there's this big thing going on as far as like the healthcare system right now, and it's a lot of not really preventative. It's more when you have an issue, you go to the doctor and get things checked out, which is great. But at the same time, there's things that you can do that preventative, like you're coming in here, taking care of yourself, going with massage, going to the gym, more holistic lifestyle that I think is super important. Because we came out of that opioid epidemic a couple of years ago, and I think a lot of people, they're trying to quick fix pain, and pain is actually one of the first things, or I'm sorry, the last thing to show up, but always the first thing to go away. And there's something else I could talk about too with the nerves. So the nerve, the innermost portion of that nerve is where your pain receptors are. So if your nerve is getting compressed, it has to get compressed a lot for you to start to receive pain. So when we take that pressure off that nerve, it might take some time for things to work themselves out. We also like to talk about like that tug of war, where as we're starting to adjust, your body's trying to realign itself. I know you were just telling me today, it's like, what the heck is going on in my body? Like, where am I in space? Because your body's trying to figure out its new position, where it's at. And it could feel like I don't really feel like I'm comfortable in my own skin, or you could feel more pain or things like that. So it's all very interesting. Have a great night, Susan.
You too. Thank you.
You're very welcome. So that's all I got. But Brian, are you ready? Guess not. Where is he? You good, Chief?
Coming. All right.
They know everything now,
Oh,
Brian.
perfect. Hi, ladies. Welcome. Thanks for joining us. So, just a couple things to ponder, a couple points to think about as we kind of close this evening is healthcare versus sickness care. What do we call our system here in the United States? Healthcare. Just name wrong, right? It really has nothing to do with health, right? Health is proactive, and sickness and disease is very reactive. And in this country, we take a very reactive approach to health, right? We wait until crisis, and then we try to get back to health after crisis, which is totally the opposite of what we should actually do. Because it is way easier to keep someone healthy throughout their lifetime than it is to get them back to health after crisis occurs. We can all agree there, right? So we always take the mindset of being proactive and doing and changing things throughout your life so that you can have a very long, healthy life. Because unfortunately, we've all been sold a bill of lies about health and about what happens as we get older. And at 40, things start hurting. And at 50, you start having to be on blood pressure and cholesterol medications. At 60, you have to stop doing certain things. At 70, it's just like, okay, well, maybe you can walk. Like, no, hard stop right there. That is all a lie, because you can continue to do all the things you want to do for as long as you want to do them, given the right circumstances. And a lot of that comes into the habits that we form earlier in life rather than trying to create good habits once things are starting to fail. Okay? So we put health into three categories. One is diet, two is exercise, and three is the thing between your ears, right? Having a positive or a negative outlook on life. We feel like those three main factors, if you continue to learn a little bit about each one of those throughout your life, every year, you can continue to watch your health go in this direction. Because think about health for a second. Like, think of your definition of health. We all have our own definition of health, right? But complete the sentence for me. I know I'm healthy because what do I hear most often, right? That's one of them. Eat well, right? Exercise, yeah. Yeah, not sick. It's because I know I'm healthy because I feel good, right? And that couldn't be further from the truth, right? Because we all know people, myself included, who know someone who felt good one morning and later that afternoon dropped dead of a heart attack. We wouldn't necessarily say that person was healthy when their artery was 99.9% clogged that morning, but they felt good. Okay? Or the person goes and gets their yearly physical done and gets some blood work taken, and they get the results back and they find out they have cancer. Happens all the time, right? We wouldn't necessarily say these people are healthy, but they are asymptomatic. So if you look up the word health in the dictionary, it says nothing about how you feel. It's optimal physical, social, and emotional well-being. That's the definition of health, not merely the absence of symptoms. Well, if that's health, it makes it a little bit harder to quantify whether or not we are truly healthy, right? And honestly, we never know. We never know when our last day is, right? But if you do things throughout your life that encourage and promote health, the more likely you are going to be healthy. And if you do things throughout your life that encourage and promote disease, then you are more likely to have some sort of chronic disease or ailment, right? And genes play a role in that, but all the research shows it's about 10%. 10% of your health is dictated by your genes. 90% is dictated by what you do and how you take care of yourself. That's a huge number, right? So, number one, diet. You are what you eat. You put garbage in, you get garbage out, right? You've heard of those terms. We encourage everyone to take a look at their diet, because we can all improve our diets, myself included, but we never encourage the 180, right? The all or nothing phenomenon, the diet phenomenon, right? Because it never works. It works short term, but it's not sustainable because of the all or nothing, right? And we can all name probably the last 10 diet fads that are been the big hits, right? Right. What is it now? It's like carnivore and like keto and like intermittent fasting. Those are the ones. And before it was like Atkins and Mediterranean and well, Jenny Craig and the Weight Watchers, right? It's all of these, right? It's calorie counting and oh that didn't work. This one's better and oh now that one's really bad and now this keto and the carnivore that's really good for you. So stick with that. And I guarantee, guess what? In 5 years, and be like, oh no, that was really. There's gonna be some new one out, and it's gonna be the new fad, and it's gonna say, oh, everything else in the past was wrong, right? So, but if you just change one thing a year, that's what we encourage, right? So, for example, say you're somebody who eats dessert every day. Well, instead of having dessert every day, have dessert every other day. We probably all have enough willpower to be able to do that. Well, I had it today, and we'll have it tomorrow, but I'll look forward to the following day. If you just do that one little simple change in your diet, you literally like cut your sugar intake in half for the year. Sugar is the most inflammatory thing you put in your body at any given time. That has a huge impact on your health long term if you continue. And then next year, change something else. Again, not like life altering decisions here. Like maybe you don't eat enough fruits and vegetables. You're supposed to have 7 to 10 servings a day. You eat 4. Well, don't try to go to 10 if you only eat 4. Just try to go to 5 or 6. Like it's an extra half an apple a day or like a carrot. It's not this massive change, right? And you do that for a year. And if you do one small simple change like that every year for 5 years, in 5 years your diet's totally different than it is today. And that has huge impact on your health and longevity long term. So diet is really important. And when you go to the grocery store, where do you shop? Around the perimeter, right? Not so much in the middle, because the perimeter, that's where all the refrigeration is. That's where all the healthy fruits and vegetables are. We say you live by the refrigerator, die by the pantry, right? Because open your pantry when you get home. Besides some maybe canned fruits and vegetables or nuts that are in there, most of the products in your pantry aren't in your best interest because they have a very long shelf life. So therefore, they are very depleted in the vitamins and minerals that your body needs to stay healthy. Things in your refrigerator are there for a reason because if you leave them out, what happens after a couple hours? They go bad, right? And even if they're in your refrigerator, after about 7 to 10 days, they go bad anyway. Those are the foods that are very high in vitamins, very high in minerals. And the more we can keep those in our diet, the healthier we'll be long term. And if you can start those habits young with your children, it even starts the playing field at a much better level than trying to integrate that later, because we see it and hear about it all the time in older kids and young adults who the parents have a really hard time trying to incorporate more healthy habits because of what was put in front of them when they were young, because it was easier, right? So diet is very important. Number 2 is exercise. You don't use it, you lose it, right? Exercise is vitally important for 2 reasons. Everybody, I guarantee, knows the benefit of exercise cardiovascularly, which I would argue is the second most important part of exercise. The most important part of exercise is what it does for the thing in between your ears. The positive hormones that are produced by your body during exercise actually outweigh the benefit you get cardiovascularly. But no one talks about that. Right? Everybody talks about, oh, it's good for your heart health, and it is, but it helps with your digestion. It has a huge impact on your mental health. I mean, about 50, 60 years ago, before World War II, for any ailment that walked into a medical doctor's office, they would prescribe exercise for a month and have the patient come back. Because 1, they knew the benefits of exercise, of what it could do for the entire body and how it could allow the body to then heal itself. And 2, they were very limited because there were very few pharmaceuticals available before World War II that allowed the doctor to prescribe certain medications for whatever symptom that might be occurring for that patient. And unfortunately, we've got away from that a lot in the current day and age where everyone has a very sedentary lifestyle. So exercise is vitally important, not just for your overall physical health, but also our mental health, right? So we can't forget that aspect. And number 3 is the thing between your ears. Do you have a positive or negative outlook on life, right? You're an optimist or you're a pessimist. You see the glass half full, you see the glass is half empty, because that has a huge impact on your long-term health. They say on average, this is research, I'm not making it up, they say an optimist lives 7 years longer than a pessimist. They've studied this. I don't know how they study it, but they've studied it. Okay. So, to that point, you also become an average of the 5 people you spend the most time with. So, think about the 5 people you spend the most time with in your life are those people that are encouraging you and lifting you up or trying to drag you down with them. Now, I don't tell people to kick people out of their lives, because some of those people that are negative are people that are in their own families, right? But I say don't kick them out of your lives, because you might be able to have a positive impact on theirs, but maybe they're just not in your top 5. Start spending more time with people who are more positive and encouraging, and less time with those people that are negative and see the bad. Because there's a certain perspective to all situations in life. I always try to see the positive in everything, right? Because we all know people in our lives who on the outside look like they have it all and see the worst in everything. And the opposite goes true as well, where you see people that on the outside look like they have very little and they see the best in everything. So we encourage everyone to see the best in everything, lift those up around you, and make a difference. Because not only if you are positive, encouraging to those people around you, will that have a positive impact on their health and their life, it will also have a positive impact on yours. So again, we feel like if you learn a little bit more about those 3 things, you can continue to watch your health improve every year, right? Because you can read the facts up there. Okay, those statistics, I think I got the new ones last year. So 2025, 2024, somewhere in there, we ranked 69th in the world in sickness, care, and disease. So that means 68 other countries are doing it better than we are, spending less than half the money. Because we spend twice the amount of money on sickness, care, and disease treatment in this country than any other country in the world. And there's 68 other countries doing it better than we are. Right? And are your healthcare costs going up or down? Right. Do your deductibles go up or down? Do your copays go up or down? Do they cover more or less?
Less. Cover less, right? But they're
Every year, your deductibles go up, your copays go up, everything continues to go up. Your monthly dues that you pay to your insurance go up, and every year they cover less. I got that right? Because that's what mine does. How does that make any sense? I think it's eventually just crashes, because I think everybody's like, we're not paying this anymore. We can't do this anymore. I think that's a good thing, because all it does is it puts the responsibility of health back into the patient's hands rather than the doctor's hands or the insurance company's hands or whatever it may be. Because then when the responsibility goes back to us, then we change and do things differently, because there's no backstop, right? If every time you had to get a knee replacement or hip replacement, you had to pay $100,000 out of your pocket to do that, you'd think twice about being overweight or doing things, changing habits, doing things different, right? So I think that's a good thing. I think that eventually happens. Maybe it doesn't crash, but I think it changes. And I think that's positive, because it's going to change more to actually prevention of disease and sickness rather than treatment of disease and sickness, which is the issue. Because treating something just allows it to continue to occur, but preventing something doesn't allow it to occur in the first place. And that's the mind shift that we all need to get to. Okay. The one that always scares me, we take 75% of all medications but in the world, but we are only 5% of the population of the world. We have the highest maternal and infant mortality in the developed world in this country, greater than any other country in the world. You can read the facts, right? They actually did a study in China 10 years ago now, where they took a group of patients, they took a group of doctors, and each patient paid their doctor a yearly stipend. So it was $1,000 to be a patient of this doctor. Kind of like concierge medicine, which you're hearing more and more about in this country. Okay, so whether that patient was sick once a year or went for their physical once a year because they were healthy, it was $1,000. And if that patient was chronically ill and had to be seen 100 times by that doctor, it was $1,000. In that scenario, what's in the best interest of the doctor? See his patients once for $1,000 or 100 times for $1,000? Encourage those patients to be healthy or encourage patients to be sick? Encourages patients to change habits and be healthy, right? And what's the difference here in the United States? Exact opposite. Okay. And again, it's not the doctor's fault. Okay. We are not against medicine. We are not against doctors. Doctors do a lot of good and they save a lot of lives. Okay. But medicine was always meant for life saving. It was never meant for lifestyle. The best invention ever was medicine, and the worst invention ever was medicine for that exact reason. Lifestyle versus life saving. Medicine always was meant for life saving, and that it is so good at that. And thank God for that. But it's never meant for lifestyle. And here, especially in the United States, it is used so often for lifestyle rather than life saving, and that's the main problem. The other issue is in the United States, we have what's called the standard of care. You heard of that definition? Okay, we are one of two countries. I think it's either Australia or New Zealand that also has a standard of care. Meaning, if a 32-year-old patient comes to a medical doctor's office with high blood pressure and cholesterol issues, if that doctor doesn't prescribe a high blood pressure and a cholesterol medication for that patient, two things can happen. One, they can be sued. Two, they can actually lose their medical license for practicing medicine incorrectly. Because according to the American Medical Association, anyone, period, who comes in with high blood pressure and cholesterol, period, must be prescribed X, Y, and Z, period. So, like, takes the doctor almost out of the equation because it doesn't have the history to support that, right? Now, if that person's 65 years old, has a family history of heart issues and cholesterol, I don't necessarily disagree. But that person's 25 years old, has a sedentary lifestyle, eats McDonald's every day, and plays video games all day. At 25, I don't think it's necessarily in their best interest to get put on blood pressure and high cholesterol medication for the rest of their life. It's more important to have a conversation about diet, exercise, and lifestyle changes to actually benefit that person long term. But in that scenario, the doctor can't even have that conversation unless the patient asks the question to deny treatment of said medication. In that scenario, the doctor can say, hey, let's get you to a sports physiologist, let's get you to a dietitian, let's get you to a nutritionist, let's get you set up with a physical therapist, whatever it may be. And here comes sign this documentation saying that you are denying my treatment and my recommendations of X, Y, and Z. That's what has to happen. How many people do that? Very few. I think more and more are doing that because there's a lot more information available today for people to say, oh, what are my alternatives to this, rather than just going blindly into what the doctor says. And again, doctors don't get into medicine to prescribe medication. They get into medicine to help people. The same reason why we get into chiropractic, to help people. But they get pigeonholed into this standard of care that kind of dictates what they have to do in certain scenarios, which is just really takes the history and takes the relationship of the doctor patient out of it, because they have to make certain recommendations based on certain things, even if they believe that it might not be in the best interest of the patient. Okay. So in that scenario, guess what happened? Do you think patients were healthier or you think patients were sicker? Patients were way healthier because the doctor was encouraging to do things and change habits to be in a healthier state, and that's better for everybody. Okay. This is an article they put. This is from the Journal of American Medical Association. The possibility that sickness care might cause net harm is increasingly important given the sheer magnitude of the modern sickness care enterprise. Serious review of all of these issues will likely challenge assumptions about the value of many current healthcare practices. Meaning, medicine has gotten so big and there's so many different arms and legs to it that we don't know if one side is talking to the other, and there might be things that we're doing that we think are helping patients as actually the opposite, and is creating severe detrimental issues to the population. And we need to really take a look at all of this and make sure what we're doing as a medical society is actually creating net benefit rather than net harm. This is the article that they put out, which makes you like, okay, I'm going to question everything now. Okay. Which is why anytime somebody's in a hospital setting, I encourage them to always bring someone other than themselves as a patient advocate. Because as the patient yourself, you can get confused with the emotion and all that stuff that goes behind it. You really need someone there with you who can think and take some of the emotion out of it to ask the right questions and make sure the treatment and the care you are or your loved ones are receiving is most appropriate for what's going on. Okay. Now, this is a little bit of a joke, right? But you can read that. I take this for that, which because healthy diet, exercise is too much work. All right. But unfortunately, this is the American way. A lot of us want a pill, potion, or lotion to fix something yesterday, not tomorrow, right? We want the quick fix, right? But the quick fix is never the good long-term answer in anything in life, right? Saving for retirement. You can't, there's no get rich quick scheme, right? You have to do small savings over time that eventually creates a problem. Same with changing your diet or your health. You small incremental, you want to get back in shape, you go to the gym every couple days to make incremental changes, right? There's no quick fix to anything that is beneficial long term, right? Well, same thing goes to your health, right? And if you are any medication taken a long period of time, eventually has a negative side effect, even if it's life-saving medication. If you're on blood pressure medication for life-saving, it creates a negative side effect, and they have to change your blood pressure medication and put you on something else for at least a period of time to allow whatever else is, whether it's your liver enzymes are going up, your kidney's not working as well. They have to change things to get you back in line, and then you can go back. With any medication, you take Tylenol for a long enough period of time, you take Advil for a long enough period of time, you end up with a hole in your stomach, you end up with, you name it. So any medication taken long enough period of time eventually creates a negative side effect. Okay. And again, medication for life-saving versus lifestyle, totally different. Okay. But the less medications you're on throughout your life, the healthier you will be. Because any more than 2 medications at one given time, there's no doctor that can tell you the possible side effects that can occur. Because there's not enough people at that age, at that gender, taking those medications. They can do a research study and say, based on X, Y, and Z, these are the things that could possibly occur in the future. 2 or more than 2. Okay. So we just have to be cautious and be very thoughtful about what we go on as we get older. If we have to go on anything, hopefully not. Okay. Now, prescribing medication, chiropractors are not licensed to do, and we don't do it. We want to make sure your body is functioning optimally. That is our main goal. Okay. And if your nervous system controls and coordinates all other systems, if your nervous system is functioning optimally, it will give the best opportunity for all of those other systems to optimally function as well. Okay. Because only 10% of every nerve in your body carries pain. 90% of every nerve in your body carries fibers of function. So, given that scenario, you could have nerve 90% cut off and not have pain associated with it. Now, 90%, you're definitely having some other issues, but it's not until it hits the 10% of the nerve causing pain that you actually think about possibly seeing a chiropractor, right? Because most people end up at a chiropractic office because of musculoskeletal pain, because that's what we're best known for. And the reason why we started doing this little presentation is because about 20 years ago, we had a patient who came into our office. And a year prior to her coming in, she bent down to tie her shoes and her back went out. Oh! She goes to her medical doctor the next day, gets her an anti-inflammatory and muscle relaxer. She takes those 7 to 10 days, symptoms kind of go away. She's feeling great, doesn't think anything else of it, going throughout her activities, and a couple months later, she bends down again, and back goes out again, except the next day, it's a little bit of tingling numbness down the back of her leg. She goes back to her medical doctor. He doesn't find anything seriously wrong, gives her an anti-inflammatory muscle relaxer again, except this time, the pain doesn't fully go away after that 7 to 10 days. She goes back. He sends her for physical therapy. She does some stretching. She does some strengthening. 3 to 4 weeks, symptoms finally go away. And a couple months later, she's getting ready to go on vacation. This is 2 weeks before vacation. I can remember the story very vividly. I don't know who packs 2 weeks before vacation. But anyway, she's reaching into the closet to get her suitcase. Guess what happens? Her back goes out again. By the next morning, it's tingling and numbness all the way down to the bottom of her foot. She's having trouble walking. She goes back to her medical doctor, goes through the same scenario, is going to give her the same medication. She says, Doc, last time this took 6 to 8 weeks to get better. I'm going on vacation in 2 weeks. If I'm not better in 2 weeks, this is my one vacation a year, I'm going to kill you. She says this in his office. He's like, okay, let's try something different. He sends her here. We do our evaluation. We say, hey, you're just treating the symptom. Let's find the cause of what's creating this and fix that. And all the pain goes away and never comes back. So she goes, starts treatment, does great, goes on vacation pain-free after 2 weeks, and returns, but continues to correct the underlying cause. And a couple weeks later, after going through treatment, she walks in one day and is greeted, hey, how's it going? How you doing? She said, this is the best I've felt in years. My low back pain's gone. My leg pain's gone. And I quote, the laxative I've been taking for the last 10 years finally started to work. At the front desk with like a room full of people. And after the girl's like, okay, I picked her chin off the chair, a table, and like, okay, let's get you back to the room before anyone else has to hear about this issue that you didn't share with anyone before. So one of us walks in, how you doing? She tells us this whole story. We're like, that's wonderful. What else have you changed? You change your diet, you start exercising. What else could have had this benefit on your digestive system? So the only thing I've been doing is coming here. So then we had to explain to her, well, the same nerve in your lower back causes back pain and leg pain, tingling, numbness. It's the same nerve that controls your bowel, your bladder, your lower digestive system, your sexual organs, and so on and so forth, that 10 years earlier created a digestive problem. But who the heck thinks about seeing a chiropractor for constipation? Well, 2 people now. Okay? No one. Because chiropractic has got put into this little box about musculoskeletal pain, headaches, tingling and numbness, back pain, neck pain, so on and so forth, when it was meant to be so much bigger than that, going back to the nervous system and how the body communicates with itself. The first chiropractic patient in 1895, whatever it was a guy who fell down the stairs, didn't even hit his head, got a whiplash, lost his hearing. He went to some magnetic healer at the time in Iowa, found some gross misalignment of the first and second vertebrae in his neck, and did some sort of manipulation that none of us would probably want to be present for, and the guy's hearing came back. That was the first chiropractic investment. It had nothing to do with pain. It had to do with a loss of hearing. So that's why we do what we do. That's why we're very passionate about what we do, is because we want to get this message out to more people to understand that chiropractic, again, we don't look at symptoms, or we don't say we heal things. We just give your body the right avenue to then take care of itself. Right? The body can heal most anything given the right circumstances. And our goal is to allow your body to do what it was meant to do. That is our goal. Because if you only remember one thing tonight, it's the next sentence up there. Your body's ability to heal itself is much greater than anyone has yet let you to believe. Okay? We are constantly bombarded from an outside-in approach. We see it everywhere. It is on the billboards, it's the magazines, it's in the newspaper, it's on the television, it's on the radio. You have this, oh, just take this. You have that, just take this. It should be the exact opposite. Fix what's wrong on the inside, and health is promoted out. Health doesn't come in a pill, potion, or lotion. It only comes from the inside out. If your diet stinks, work on your diet. If you're not exercising, start moving. If you've got a negative, pessimistic view of the world, work on prayer, meditation, whatever you want to call it, to change the way you see the world and your habits, and maybe the people who surround you. Okay? Those are the things that will have a huge impact on your health and longevity long term. Okay? We still have patients who are here in their 90s who have been patients of my father's since he started practice in 1980 that are still coming today, One of them was here today. She's in her mid-70s. Okay. Not because they have pain, not because they have chronic symptoms. It's because they want to stay healthy and well. Okay. So, are you healthy or sick when you have a fever? Okay, you might feel sick, right? But you are healthy. That is doing your body doing what it was meant to do. What's the first thing most people do when they have a fever? Take Tylenol. Reduce your fever. Guess what? Research shows you prolong your illness 2 to 3 days longer by taking a Tylenol to reduce your fever. Because all you do by reducing your fever, you allow that bacteria or virus to replicate, and get stronger and stronger. Because bacteria and viruses can only live at a very small temperature range. So by bringing your temperature down, you allow that bacteria or virus to get stronger. And then it takes 2 to 3 days longer for your immune system to get built up enough to then knock that virus or bacteria back down. Right? But how we've all been taught or all told to believe that fevers are bad and that fever should be taken care of. Now, 103, 104 fever, you have to be more careful about. But any low-grade fever, if you can suck it up, you can deal with it, you will get better faster because that's your immune system doing what it's meant to do. We were made remarkably, okay? We all came from 2 cells and 2 cells only. To me, that's a miracle. We think an outside-in approach is going to fix something or heal something. It's like, if you think about it for a second, it makes no sense. It makes no sense, but we are constantly bombarded with that everywhere we look. So if we see that enough, we start to believe it. Okay? So all these people seek chiropractic care on a regular basis, not for pain management, not for symptom relief. Unless they're no longer living, we can't bring them back from the dead. Okay? We don't go that far. But who are they, right? They're professional athletes, they're performers, they're actors, actresses, right? Because 0.05 seconds doesn't matter to us, but it matters to the guys who were playing the Super Bowl last night. Okay. We can't, somebody shows up to a concert full of 50,000 people and like, oh, I'm calling out sick tonight. It would be the last performance ever, right? Now they're probably lip sync now, but they seek chiropractic care on a regular basis to maintain and optimize their health and their performance. Every professional sports team today has a chiropractor on staff. They pay these people a lot of money, whether they're on the field or off the field. They much rather have them on the field. And if they do get injured, they want to get them back on the field as quickly as possible. Now, this says chiropractic. I lump in alternative healthcare. If you hear the word alternative healthcare, that's healthcare. All the other stuff is sickness and disease treatment. Alternative healthcare is true healthcare. So what gets lumped into that, right? It's like acupuncture, chiropractic, massage therapy, physical therapy, occupational therapy, Reiki therapy, you name it, right? Anything that gets lumped into alternative healthcare, the more you can stay in that realm, the better, right? We always encourage people to start from least invasive and then go up to most invasive. And the more we can stay in the least invasive, all those alternative treatments, the better off we are long term, okay? So alternative healthcare bases all of its actions on restoring and maintaining health. All others are designed to treat disease. So chiropractic can help with these things. Chiropractic is not the panacea for everything. We don't want you to believe that. It's not, okay? But these are certain things that our patients have said, hey, I came in with neck pain, now my thyroid's all messed up. I came in with upper back pain, and now my acid reflux is gone. I came in with low back pain, and I couldn't get pregnant, now I'm pregnant. Because we've heard all of those stories, okay? And these are some of the most common things that we hear. About 60% of people who walk through this door still walk in with musculoskeletal complaints because that's what we're best known for. But 30% come in with digestive issues, only constipation, acid reflux, indigestion, bloating, get all those things that go into that. Because here in the Northeast, that's one of the most common things that people will seek medical treatment for in this area, in the Northeast, because we are constantly high stress, always on the go, eating on the go. Diets usually aren't that great. Our largest meal is when, okay? So that ends up over time creating a tremendous amount of digestive issues because if we're always eating on the go too, Your body never goes into parasympathetic, which is your rest and digest. It always gets stuck in sympathetic, which is your fight or flight. And when you're in sympathetic, you do not digest your food. So when you're eating in sympathetic, fight or flight, your food just sits in your stomach and ends up creating a lot of other issues. So there's three main things that if you simply do these, will take care of 90% of digestive issues. One is have your larger meals in the morning and midday and a smaller meal in the evening. Two, don't eat 2 hours before you go to bed. So it allows your body to have proper digestion. And number three, after every meal, get up and move around to 10 to 15 minutes because your entire digestive tract is made of smooth muscle. Smooth muscle only contracts when you move. So if your largest meal is at the end of the day, which a majority of people's it is, and you finish dinner and you walk from the dinner table to the couch and you sit there for a couple hours and then you go from the couch to your bed, your food's still in your stomach. And if you go to bed at night and your food's still in your stomach, it ends up creating a lot of digestive issues as we get older. So movement after starts to stimulate the entire digestive system. And then if you give it a couple hours before you go to bed, that food gets out of your stomach into your digestive system so your body can absorb it and your digestion is complete by the time you go to bed, which will resolve a tremendous amount of digestive issues by just doing those three simple things. And the last 10% is childhood related, is asthma, allergies, ear infections, constipation, GERD, colic, whatever it's diagnosed as well. Okay. Anybody know what that stands for? Anybody in sales? What's in it for me? Right? That's why you're all here, right? You can read all those. But the most important one is the one on the bottom right. Adds years to your life and adds life to your years, which is exactly why I got into this profession. That was not my plan. My father started this practice. I grew up in Burnsville. I was not going into the family business. I was going on Wall Street with all my friends' dads who that was seemed really cool, right? And I show up to college my freshman year. I'm a major in finance. I don't even remember. And my roommate shows up. I call the box of CVS. Like every over-the-counter medication you could possibly have. He walks in with a box of it. I'm like, what is that? Like I grew up in a chiropractic family, right? Like if I got sick, my father was like, come get adjusted, take these extra vitamins, drink this water, and go to sleep. That was kind of it. Okay. So I'm like, what is that? And he's like, oh, this is for my knee, and this is my allergies, and this is my stomach hurts. I get a headache. And I'm like, huh? He's looking at me like I have two heads. I'm looking at him like he has two heads. And I'm like, okay, like what? And I'm going through my freshman year, and I recognize that anytime any of my friends has any sort of symptom, it's just like, oh, just take this. You just take that. Or, oh, can you have one of those? Oh, you got any Advil? You got any Tums? What? And I'm like, what? My best friend, I played hockey in college. One of my best friends before every game would take Sudafed. Like he wasn't even sick. He's like, oh, it opens up my sinuses. I can breathe more and get more oxygen. I skate faster. I'm like, you know, it like speeds up your heart. Like that's like the last thing you should be taking before like a sporting event. Like your heart's gonna explode. Like don't do that. He's like, no, you don't know what you're talking about. And I'm like, is this the way the world works? You just take a pill for a symptom? Like you don't want to just fix the problem? And I would try to have a conversation. I'm just like, well, what are you talking about? You're weird, right? And but there's a different way. You can do this, or I've got this, or here's a digestive enzyme, or here's a no, well, like, and they weren't wrong, right? And I wasn't wrong. It was just a different perspective. They were just that's what they knew. That's what they grew up on. As what I grew up on was just different. And I'm like, but more people need to know this. More people need to know that there's a different way. And after freshman year, I'm like, I can't do this. I can't do this anymore. Like I know too much. I need to go and I need to change this. And I changed my whole major. It was a major pain in the butt. But whatever. I wouldn't change it for the world. Okay? Because our goal here is to help people understand that there's a different way. That you don't have to go through life treating symptoms, and you don't have to go through life just waiting to not be able to do something any longer because of some sort of ailment or some sort of issue. doesn't have to be that way. If you choose that to be the way, to make changes and to do things differently so that you can have health into your golden years, right? Because what's the point of working so hard all your life and saving money to get to the point where you can eventually retire and then not do all the things that you love to do anymore? That would be like my biggest regret ever. So we encourage people to do things differently, which is why we started doing this, which is why I got into this profession, is to help people understand that there is a different way. Because our goal is adds years to your life and adds life to your years. It's not to help people with back pain, okay? And that's why a large majority of people show up here, which is fine. Our number one goal is to help all people feel better as quickly as possible. But secondly, to help them understand that they don't have to go down the road that a majority of, especially the US population, goes down as they get older. Because, like, look around the corner, there's more long-term health care facilities going up in, like, Basking Ridge. There's like 2 new ones in the last 5 years, and they're going up everywhere because people haven't done the things to change habits throughout their life. And now they're stuck having certain consequences of that. Okay? 2 reasons to do this talk: tell you what chiropractic is and what it's not. It's not better than medicine. It's not worse than medicine. It's just a different perspective. And some people hear this and say, fix my back and I'll be back when my back hurts. And that's fine. And some people hear this and said, well, that makes a lot of logical sense. I want to know more. If that's you, come talk to us. If you have things you haven't shared with us, let us know. We want to know more because there might be other things we can do to help you along your road of health and wellness. 2 kinds of people we see. We obviously see people who are symptomatic, but we're seeing a lot more families than ever before. We're seeing a lot more younger children than ever before because parents understand the message we're talking about today. Because a majority of the people we see symptomatic between the ages of 30 and 60, those issues started between the ages of 0 and 30. Do you know why? Because that's when we go through life with reckless abandonment. Okay, that's when we play contact sports. That's when we learn how to drive a car. That's when we learn how to ride a bike. That's when we jump out of trees. That's when we go off giant ski jumps and skiing, all the things that after about 30, I found that, like, okay, well, it just doesn't hurt for a day or two. Now it hurts for a week or two. Maybe I should stop doing that, right? But the thing is, your body keeps perfect track of all the injuries you've had throughout your life. They just show up later. Because when we're young, our bodies are really good at compensating, shifting, and changing to help us feel better. But your body keeps track of all those things, and they show up later. The thing is, if you correct those issues as they occur through childhood and early adulthood, they never develop into the more chronic issues we see later in life. And I think he's 18 now, so we have an 18-year-old competitive, like, mountain biker, like probably going to go to the next Olympics competitive, like very, very good at what he does. He's been a patient probably for 15 years. And every time when he was in high school or middle school, every time he'd walk in, I could tell he'd walk in because I can hear the door open in the back like this. And I can hear him say, "Mom, I told you I was fine," right? Common teenager, right? And I just want to play with my friends. Why were you here? And his mom would, every time he would fall off his bike, his mom would bring him in. Because he would just bounce it. He'd get back on. He'd just keep going. Like, we're falling off our bike. We're making sure everything's still attached. Like, okay, give me a second. Let me see how I am. But every time, and of course, you fall off your bike, everything's out of balance. We take 1 or 2 adjustments, everything would totally resolve. No issues going forward. If his mom didn't do that for him, those injuries would compile and compile and compile. And eventually down the road, it would be a much more significant problem. So by correcting those issues as they occur, they never develop into the more chronic issues we see. Here, for a couple questions. Who here in the last year has gone to see their dentist? Okay, why do you go see the dentist? If you haven't gone to see the dentist, I encourage it. You go see the dentist to make sure your teeth are healthy, right? You go a couple times a year to get them cleaned and make sure they're healthy. And at the end, the dentist comes in, he starts looking, and he kind of, oh, okay, is that tender? No, okay, well, we found a little tiny cavity here. Sometimes they find cavity, you don't even know it's there. You don't feel it. You say, don't worry about it, doc. It's just a small cavity. Well, let's wait until it needs a root canal. Who's doing that? No one. And if you do, you probably got to find a new dentist because you're like, you're crazy. Go somewhere else, right? We are all very preventative in our dental hygiene. All of us, right? Dentists have done a fabulous job at encouraging people to be proactive in their dental hygiene. One is because it's part of who we are, right? It's our first impression. It's our teeth. It's our smile, right? We're very vain, right? But two, if our spine was on our face, we'd take better care of it, right? It's a joke, right? But the spine, every single one of these little white things in your mouth, they've gotten so good at it, they could take it out, they could put a new one in, and literally nobody would be able to tell the difference. There is no such thing as a spine transplant. There will never be. It's too intricate of a system. You only get one. Tonight you learned about the importance of the spinal nervous system, how important it is to your health long term. Take good care of it. Okay. Number two, whoever is going to get their physical done, I encourage everyone to get a physical done. You've had plenty of physicals done. Okay. I go once a year to get a physical done and get my blood work taken, because if things start to go out of range, I want to make sure I change habits and do things differently to get them back into range before I have to do something more invasive. All right. Encourage everyone to go and get a physical once a year. When you're at your medical doctor getting a physical, did they check your spine and nervous system to make sure it's healthy? No, the most common thing, okay, bendo, oh no, scoliosis, right? That's about the extent of what an MD is looking at for spinal health, right? Did your OBGYN check your spine? No. Did your dentist check your spine? Optometrist check your spine? No. Okay. Doctors today are very specialized in what they do. There's literally a doctor for every part of your body now. Okay. The only doctor that's checking your spine and nervous system for health is a chiropractor. Okay. So for spending some time with us today, learning more about what we do and why we do it, anyone in your immediate family, children, husbands, they would like to be checked by us, we will do that 100% complimentary. Okay. Same history, same exam, necessary x-rays if necessary. We usually do not x-ray children. We would love to do that for you and your family so that you can make better health decisions for them going forward. Okay. There is no obligation to do anything besides an evaluation to know whether or not there is something present. Because if you can correct those issues before they become symptomatic, it's much better for yourself and for them long term. Okay, so we'd love for you to take us up on that. This is not a sell. This is no obligation, nothing beyond that. It's just so that you have a better understanding about what's going on in your family's spinal health so that you can make better health decisions in the future, knowing whether or not there's something going on. Because we've had this happen in the past where we've done evaluations, somebody has a neck issue and they decide not to take care of it right now, but the same nerves from your neck are the ones that go to your thyroid. And we say, well, if you ever end up with a thyroid issue in the future, make sure you come back and talk to us. Because you know what happens if you go to a medical doctor and you have a thyroid issue? You have two options. For the rest of your life, yes, or cut it out. If you have a thyroid issue, those are the two options. You have an overactive thyroid, you have an underactive thyroid. Two options. Thyroid medication for the rest of your life, cut it out. You know, the chiropractor told you have a neck condition and the nerves from your neck go to your thyroid. Guess what? You just added a third. Now you go back to the chiropractor and they work on your neck and their thyroid normalizes. Or it doesn't. We don't know. But at least now you have a third option that you wouldn't have had in the past. And the same goes with mid back, low back, whatever it is. Okay? We just want you to have a better understanding so that you can make different health choices in the future based on whether or not there's an issue. And if everything looks great, we're like, hey, great. You will look perfect. We'll see you in a year. Come back just like you go to your medical doctor and get a physical every year. Come back here. We'll do a physical exam on you and make sure that nothing's changed. If there is, we're going to let you know that, but there's no obligation to do anything beyond that. All right. If there is things you haven't shared with us regarding your own health, make sure you share them with us next time here because there might be other things we can help you with. And if there is a loved one or a friend or a coworker, someone that you know who's struggling with some sort of health issue, or they're on some sort of lifestyle or symptom relief type of medication because they don't know what else to do, if they haven't tried a chiropractor, encourage them to. And whether it's here or whether it's like across the country, that doesn't matter, because you truly could be saving their lives. Because the people that walk through this door, it's usually not the first door they walk through. It's the last door they walk through because they've tried everything else. Doctors have told them that they're crazy and there's nothing wrong with them. And their friend said, go see my friend, the chiropractor. And they're like, I don't even know why I'm here, but I don't know what else to do. And my friend told me to come here. And I always tell people, well, I promise you, the only thing I can promise you is we won't make you worse, but we will give you hope and we will help you and find out if whether or not what we do can help you. So if there's someone that you care about and it's in a different part of the country and they want to try a chiropractor, let us know, because we kind of know people all over, and we'll help you find someone who's appropriate, because there's good and bad in everything. Good and bad medical doctors, good and bad chiropractors, good and bad physical therapists, whatever, you name it. So we'd love to help you find someone who's good at what they do in wherever that person may live. So we appreciate you. Thank you for spending some time with us. Sorry, this ran much longer than we thought it was. Have a great evening. Get home safely, and we'll see you all real soon. Thank you. Of course.